Ever wondered why hospitals are so keen on getting that baby on your chest right after birth? Well, it turns out that holding your baby close isn't just a lovely way to start life. It's got some serious benefits backed by science. That's why today, in the 5th episode of my Fourth Trimester Series, I want to talk about the practice of Kangaroo Mother Care and skin-to-skin contact. I'll show you why this close contact is so important, how to do it, and address any concerns you may have. So you've probably heard of the terms Kangaroo Mother Care and skin-to-skin contact. What do they actually mean? Well, skin-to-skin contact is exactly what it sounds like. It's when you hold your naked baby against your bare chest. No fancy wraps, no clothes between you, just you and your little one, heart to heart. It's that simple. Now, Kangaroo Mother Care, or KMC, basically takes this idea and runs with it. It's got its name because, well, it's kind of like how kangaroos carry their babies. KMC involves holding your baby skin to skin for extended periods, often using a wrap to keep them snug against you. But it's more than just cuddling. It also includes things like exclusive breastfeeding and early discharge from hospital when possible. KMC was actually developed back in the 1970s in Colombia by Dr. Ray and Dr. Martinez. Hospitals were struggling with overcrowding and a shortage of incubators for premature babies. So they came up with this brilliant idea. Use mum as the incubator. Turns out it worked amazingly well, and now it's used all over the world. So while all KMC involves skin-to-skin contact, not all skin-to-skin is necessarily KMC. Think of KMC as the deluxe package. It's a more structured, prolonged approach to keeping your baby close. But whether you do full-on KMC or just some skin-to-skin time, your baby will be reaping the benefits. I want to show you how to do Kangaroo Mother Care or skin-to-skin contact step by step. First, find a comfortable, quiet spot where you won't be disturbed. Then you'll want to be sitting upright or slightly reclined. Next, undress your baby down to just a nappy. If it's a bit chilly, you can put a hat and socks on them. Obviously, I've got a dummy baby here, but yours would be wearing a nappy. Now, open your shirt or take it off completely. Remember, we're going for direct skin-to-skin contact here. Obviously, I'm going to keep my top on, but you would have a bare chest here. Gently place your baby on your chest, tummy down. Their head should be turned to one side, with their ear against your heart. This position helps keep their airway open. Obviously, again, this is a dummy, but your baby's head will turn a lot easier than mine. If you're using a wrap or carrier, now's the time to secure your baby. Make sure it's snug, but not too tight. Your baby's face should always be visible and their nose and mouth unobstructed. For Kangaroo Care, you'll want to keep this going for at least an hour, ideally longer, but even 15 minutes of skin-to-skin can be beneficial. This is a great time for breastfeeding. Your baby is already in the perfect position, and the close contact can help stimulate milk production. Remember, safety first. Always make sure you're alert when you're holding your baby like this. If you feel sleepy, it's time to put the baby in the crib. Have a look at my safe sleep checklist for how to do this safely. And dads and partners, you're not off the hook. You can do skin-to-skin too. It's a great way to bond with your baby and give mum a break. All right, let's talk about why Kangaroo Care and skin-to-skin contact are such a big deal. For you mums out there, this close contact is like a natural stress buster. When you hold your baby skin to skin, your body releases oxytocin. Yep, the same hormone that helped you during labour. This love hormone helps you relax, lowers your blood pressure, and even reduces the risk of postpartum depression. But that's not all. This skin-to-skin time is amazing for getting breastfeeding off to a great start. It stimulates milk production, like we said before, and can help your baby latch more easily. Babies who get lots of skin-to-skin time tend to breastfeed more successfully and for longer periods. Many mums find that after some skin-to-skin time, their baby practically crawls to the breast on their own. Make sure you grab your free download 10 Ways to Make Breastfeeding Easier in the description below to help you along your breastfeeding journey. Now for your baby, the benefits of Kangaroo Mother Care are incredible. Skin-to-skin contact has a whole range of physiological and developmental advantages. First off, it's a powerful regulator. It helps stabilise your baby's heart rate and blood pressure and promotes regular breathing patterns. For premature babies, this can mean fewer episodes of slow heart rate or pauses in breathing, known as apnea. But it doesn't stop there. Skin-to-skin contact assists your baby's developing nervous system. It stimulates their senses and promotes brain development, potentially leading to better cognitive and motor skills down the road. And here's something fascinating. Your body heat isn't just keeping your baby warm, it's teaching them how to regulate their own temperature. Your body actually responds to your baby's needs, warming up or cooling down as necessary. It's more effective than an incubator. Kangaroo Care is also a natural stress buster for your baby, as it lowers their levels of cortisol, the stress hormone. This helps them sleep better, cry less, and stay calmer overall. It can even help manage pain during medical procedures. For premature babies, Kangaroo Care can be a game changer. It's been shown to improve weight gain, reduce the risk of severe infections, and even shorten hospital stays. I'll pop some studies about this in the description below. But even full-time babies can reap huge benefits. That close contact with your skin and microbiome helps populate their gut with good bacteria, giving their immune system a head start. Plus, it helps them adjust to life outside the womb and supports breastfeeding. So what's the science behind all this? Well, it turns out that being held close to mum mimics the conditions of your womb. Your heartbeat, your smell, the warmth of your skin, it all tells your baby's body and brain they're safe and can focus on growing and developing. In essence, you're not just cuddling, you're providing a living, breathing, loving environment that's perfectly tailored to your baby's needs. Now, as amazing as KMC is, there are situations where we need to be cautious. For babies, if they're critically ill or unstable, your medical team might advise waiting until they're stronger. This includes babies on certain types of ventilators or those who've had recent surgery. For mums, if you have an active skin infection on your chest or breasts, it's best to wait until that clears up. Also, if you're extremely ill or on certain medications that could affect your ability to safely hold your baby, you'll want to check with your doctor first. But don't worry, if you can't do skin to skin right away, there are alternatives. You can still bond with your baby through gentle touch, talking, or singing. And remember, in most cases, these are temporary situations. Make sure you talk to your healthcare team and get them to work with you to start KMC as soon as it's safe. Although KMC has been around for a while now, there are some misconceptions and concerns I want to briefly chat about. Kangaroo Care is only for premature babies. Nope. While it's true that preemies can hugely benefit from KMC, full-term babies love it too. I'll spoil my baby if I hold them too much. Oh, if I had £1 for every time I heard this. The truth is, you cannot spoil a newborn with love and attention. In fact, responding to your baby's needs helps them feel secure and can lead to greater independence later on. There are plenty of studies about this now. Kangaroo Care is just for mums. Absolutely not. Dads, partners, you can all get in on this. So if mum's taking a nap or you just fancy some bonding time with your baby, pop them on your chest. KMC might interfere with medical care. In reality, most NICUs now encourage KMC as part of their care routine. They'll work with you to make sure your baby gets both the medical attention and the skin-to-skin time they need. I don't have time. Now, I'm a mum of 2 and I know my biggest challenge was finding time for skin to skin. Between nappy changes, feeding, caring for my other child and everything else, it felt overwhelming to add another task. But KMC isn't separate from baby care, it's part of it. You can do skin to skin while feeding or even while catching up on your favourite show on TV. We know that the benefits of early skin-to-skin contact can last well into childhood and beyond. Studies have shown that babies who received lots of skin-to-skin care as infants tend to have better emotional regulation, stronger parent-child bonds, and even improved cognitive development as they grow older. So it's well worth doing. In the next episode of this Fourth Trimester Series, I'll be talking about different feeding options, tips for success, and how to choose what's best for you and your baby. So make sure you're subscribed to my channel to catch this one.